promote your business? Do you want to talk about your nonprofit organization? Do you want to talk about your culture? Introducing the online web TV, Afrique Today, Fogham, where you can watch us live at the same time on 4 platforms: Facebook, YouTube, Twitter, and using the Afrique Today app. Download our app today for Android or Apple. Promote your business today. For more information, go to www.afriquetoday.com. Afrique Today, the best of digital TV.
Good evening, and thank you for joining us on this segment of our virtual discussions brought to you by Immigrant Community Services and the Michael and Maurizia Pacha Foundation, working in partnership with Afrique Today TV. Our goal is to bring you critical resources and information as we deal with the state of health of ethnic minorities. We're joined today by Dr. Manka and Tanya, and we're going to be talking about the state of health of ethnic minorities, but I'll briefly quickly introduce to you Immigrant Community Services and the Michael and Maurizia Pacha Foundation for our new viewers. So the Michael and Maurizia Pacha Foundation is a nonprofit that is based in Montgomery County, Maryland, and is dedicated to advancing health awareness around the world since June 1998. They offer services across multiple areas, including treatment assistance, education, training, follow-up and support, and advocacy. Their target areas include cancer, HIV/AIDS, mental health, domestic abuse, malaria, high blood pressure, and diabetes. The foundation has been involved in the design and implementation of several cancer and HIV/AIDS programs. These initiatives take a direct approach to supporting those diagnosed and the effects on other aspects of life. Immigrant Community Services, also known as ICS, is also a Montgomery County community-based nonprofit whose mission is to respond to the needs of the new immigrant populations, particularly the vulnerable and underserved, in the Washington, D.C. metro area. ICS provides comprehensive and respectful services in a culturally competent way, and as such, promotes community health and economic empowerment and civic engagement as a solution for improved integration outcomes. ICS is a Maryland registered 501c3. We're going to start our day with Dr. Manka right now this evening. And Dr. Manka, welcome, and Tanya, welcome.
Thank you for having me.
So, Dr. Manka, I'll start with you. Why must we be concerned about healthcare in racial, ethnic minorities and disadvantaged populations?
Thank you so much for asking that question. That's a question that I've heard asked a lot of times. So I think first we think about the moral imperative. If someone is sick, if your neighbor is sick, then you automatically feel, you have sympathy and compassion for them, and you're worried that, they're sick. And what we find in the United States is that racial and ethnic minorities and disadvantaged populations bear the burden of a lot of medical conditions. So if you think about my research population is racial and ethnic minority older adults, they bear a higher burden of activities of daily living limitations. They bear a higher burden of dementia. And then if you think about just the racial and ethnic minority population in general, they bear a higher burden of chronic conditions such as hypertension, diabetes. And really, we begin to think about why are these people bearing a higher burden of these conditions? And it ties back to some of the conditions in which they live. And so as a society, if we want to have equity and we want people to be well and we want our neighbor to be well, and I know some people are Christians and we're called to, be one another's keeper. So we think about it in a society, it's important that everybody's doing their best and it's healthy and safe in wherever they are. So if one person is sick, then we as a society together are not well. So it's important that we care about the health of those who are most vulnerable because it affects us in one way or the other.
Thank you so much. So we know that health inequities among racial minorities are pronounced, persistent, and pervasive. And we also know racism may be one of those causes of these inequities. We've read that a couple of studies that report that experiencing racism actually exhibit worse health than people who do not report it. So tell me, why do we find that racial and ethnic minorities and disadvantaged face multiple health disparities? And when we're talking in this context of racism and this persistent racism and inequities?
That's a big question. And so one of the reasons for the higher burden in racial and ethnic minorities is racism. And then if we think about how does racism play itself? Racism manifests itself in several different ways. So it manifests itself in the social circumstances in which we find ourselves. So we find that because of racism, racial and ethnic minority populations have to live in poorer neighborhoods, neighborhoods with high crime, or neighborhoods with stress. Because of racism, racial and ethnic minorities have limited access to resources. Because of racism, racial and ethnic minority populations might not even be able to access home loans. So there's like a myriad of things that racism is implicated in, and so we're not able to. If you think about maybe like the older population in the US prior to civil rights and all of that, people were not even able to go to school, and you can think of all of the benefits that come along with having an education, having a better job, having higher income. When you have higher income, you have access to more resources and more, money to take care of your health insurance. So it's like racism is something that is implicated in a lot of things that we as a society face. And so when we think about racism, we use the umbrella term racism, and I feel compared to define it as a racial discrimination researcher. So racism itself is a system that disadvantages. Basically, racism classifies groups. It classifies one group as a privileged group and another group as an underprivileged group. And so what it does to the privileged group is that it allows them to access resources. And then the group that is classified as disadvantaged or underprivileged doesn't have access to resources. So that is racism as a system. And then when we think about racism itself, has different types. So there's the structural racism, which happens and manifests itself in systems. The classic case of structural racism is redlining and things like that, and segregation, where people had different bathrooms. So those were systems that were set in place to privileged people who had access to certain resources and certain places. So that is the structure. And then you get to what is called interpersonal racism, which is what is happening between people. And so this is where somebody thinks, I am privileged, I am better off than another person, and so I'm going to prejudice or stigmatize another person. And so you have people walking around and looking at other people as if they're poor, looking at other people as if they're less educated just by the way they look, or in the case of racism that is targeted at immigrants, just by your accent, or even other people who have accents. They're like, that's interpersonal, where it's between people. The third kind of racism or racial discrimination is what goes unseen, which is what is called internalized racism. And what we find with internalized racism is that people have grown up in a culture where they've been classified, let's say, as an underprivileged or a disadvantaged group in such a way that they begin to internalize all of these processes. So, for example, you grew up in a society, let's say the United States, that has typically classified Black people as less than. And so people begin to internalize those things, and then they don't basically get engaged in society to do the things that they need to do to be able to access resources and be better off. And so those are the different types of racism that we see manifesting in the society. And then what happens is that these types of racism affect health in three different ways. The first part of it is that, especially in the internalized way, is that the racism comes to you and you feel it in your body and you get stressed. And so I don't want to get into the biology of things, but as you get stressed, what happens is your stress response system in your body builds up. And once it's building up, it's sustained building up, is not good for you. And so that begins to put you at high risk for conditions such as hypertension, diabetes, and all of these other conditions. So we begin to see that racism is implicated in the stress-related diseases such as hypertension and diabetes. And then the second part of racism we're talking about and how it affects health is the access to resources. So if somebody thinks that they're going to go face racism at a doctor's office, they might be less likely to go there. So you're afraid that you're going to go there and somebody's going to face interpersonal racism, where somebody's going to treat you a certain way, somebody's going to perceive you a certain way. And so you begin to now not access resources. And so it's kind of that mechanism where it's either happening, you're internalizing it and it's causing stress in you and leading to health outcomes, or you're not going out to places that you should be going out to access resources. And so that is not affecting your health outcomes. And so it's like that racism is the big picture thing that is affecting everything else around racial and ethnic minority communities in the United States. And then that in itself is playing a cycle in our body and our physiological response that now is affecting our health outcomes.
Oh my goodness. Thank you so much. I mean, I think sometimes we take it for granted, when you talk about racism and health inequities, how deep the issue is and how it carries on into health outcomes and long-term illnesses, and that can even be passed down. So how can providers account for one's culture when we talk about culture in the provision of healthcare?
So in the provision of healthcare, there's a couple of things that I'm a nurse as well, so we as providers, I consider myself a provider, so we as providers need to do. The very first thing is that we need to recognize who we are. Everybody has a bias, everybody's an individual, and culture is something that is personal, family, there's circles of culture. So each family has their culture, each society has their culture, each profession has their culture. So you have to be keen to recognizing what are the personal biases that you carry and how it relates to how you provide care to the people that you come across. The second biggest thing that I tell my fellow providers is listening. And that's a big aspect of cultural humility, where you recognize that the person that you're encountering is the expert on who they are, is the expert on their situation, is the expert on their cultural heritage, their lifestyle and everything. You do not assume anything about whoever you're facing. So if I'm a doctor and I see a Black person in front of me, I do not immediately assume that this person, like the stereotype that goes around, eats a lot of fried chicken. We ask the person, if the person has hypertension and you want to manage, you want to talk to them about diet, start by asking, what is your diet like? What do you eat? Don't go assuming anything about anything. As healthcare providers, we need to be in tune, asking our patients, what would you like to have? This is what's going on medically. How do we proceed? These are some of the things that could happen. Really getting to listen to the patient. And when now we come to immigrants and people who are linguistically challenged or people who are new to the US and do not speak English, we have to also make sure that they have access to translation, they have access to transportation at the services. And even as healthcare providers, we also need to be making sure that we are educating people to recognize the need for prevention. And I'm sure that is something that Immigrant Community Services and Pacha Foundation are doing. And one of those that I think I really highlight that as an immigrant, because coming from a country like Cameroon, where primary care was not something that was highlighted, we only went to the doctor when we're sick. So I recognize that we have to go out into the community and educate people to go in and get their annual physicals and get checkup, because that's new to us and it's new to a lot of people. So as healthcare providers, we have to practice cultural humility by knowing ourselves and recognizing who the patient is in front of us and what they need, but also providing culturally responsive things that are necessary to get people the care that they need, like language interpretation, like transportation, and the education that they need related to their health and health outcomes.
Thank you so much. You mentioned briefly about providers asking clients to relay how they feel. And I think advocacy is a big issue, self-advocacy. But as you know, a lot of immigrants come from countries where there's a huge, if not a little, mistrust for governments, for systems. And so when they are here, how can one take control of matters that affect their health and advocate for themselves?
So that's a big question, and it has to deal with trust. And trust is not built overnight. So it's something where if I'm the healthcare professional, I just have to continuously give the correct information, because part of what has happened in the past, why we don't trust systems, is that the systems have failed us. And so if we're dealing with a long history of somebody coming tells you something today and tomorrow they're doing something very different, it's going to take the person a lot of time to believe that whatever you say is actually what is truth. So as healthcare providers and as a community, we need to continuously show up, say the right thing all the time. And for most people, At least I'm doing a lot of work in the community with the COVID-19 vaccine right now. It's just showing up. The first time we have a conversation, people were apprehensive. The second time we have the conversation, the needle is moving, but you might not see that externally, but it's moving. And it's like, it's not to the fourth or the fifth time that you're doing education, you're talking to somebody and you've shown up 5 times that the person's like, oh, this person is actually serious and is actually has my interest at heart, because they've shown up like 3 or 4 times. But what often happens is that education and providers go into racial and ethnic minority communities once. Most of the times they go in, they gather information, and then they leave. And then it just perpetuates that cycle of distrust where people are like, oh, that person came again and took information and left. But what I recommend to providers is that we show up often, consistently, say what we need to say, and do what we have said we're going to do. We say things and then we don't do them, or we say things, we say we're going to come back, and then we never come back. But also, what I've begun to highlight is that in racial and ethnic minority communities, we have trusted leaders in the community. So we count on these leaders to always be responsible for getting the information and bringing it back to the community. And that adds to the trust, because if a trusted person in the community is saying something, then somebody's going to believe. Or it could be that they heard the information once from somebody who's an outsider, and then the second time they're hearing it from somebody they trust. That builds kind of a level of added knowledge that then moves the needle towards trusting whatever information they're being received. So it's going to be a two-pronged approach, as healthcare systems need to be coming into the community, and community members need to also be moving towards the healthcare system in such a way that we come together and meet in the middle, so that we're bringing the information into our community. And the key community leaders like White Pacha and Immigrant Community Services are doing, they're also bringing the information into the community. It's that approach of coming together that I feel like is going to help build trust and begin to eliminate some of the health inequities and disparities that we're seeing in the community.
Thank you so much. Trust is very important, and you talk about consistency in services as well. And so for folks who say, well, I've had these groups, or I've had, I've gone to a healthcare provider and I'm not too comfortable with them. And we live in an environment and a place where there's so many resources. Why is it important to know your options when it comes to where to seek healthcare and other resources that impact healthy living?
So for one thing, you want to know that you're getting the best care. And so if you know the options, then you can identify the best care. But also knowing the options, there's also preferences, there's also matching of cultural relations, trust, and there's also ingrained, how do I put it? There's an attachment that you have with some people and you don't have with some people. And there's an immediate trust that is built with some people that you don't even know why it happens. So if you know your options and you go to option A and you recognize that this relationship is not really working, and I always encourage people to, give it a try it. If you go to this person once or twice and things don't work out, you've tried it once or twice and it doesn't work out, then you know that there's plan B or there's option B, and you can go to option B and see how that relationship is building. But we really need to recognize what we have available to us and seek it, so that we can begin to improve health in our community. Because I know the biggest part is that people do not know half of the resources that are available for us in the community. And so there's a lot of options available. We need to know them. And once we know them, we can then identify those that are really beneficial for us and really match our goals and aligned with our values and all of our preferences.
Yeah, thank you so much. And you are right. We are very fortunate to live in the DMV area. I live in Montgomery County, and we are very fortunate to have a lot of resources available to us, and really good resources and culturally appropriate and culturally sensitive resources. But then again, when you have so many options, as we talk about, it gets complex, right? People get confused. There's just too much out there. There are just too many choices. So what are some best approaches for navigating our complex healthcare system? I mean, when you talk about Medicare, Medicaid, other healthcare services, different specializations, free clinics and all, it's just so much, which is great, but it also can be intimidating for somebody who is coming into a system where, it's like, where do I start? How do I navigate this complex healthcare system?
Yeah, that's a very good question. I remember just having a conversation with somebody saying that there should be a program for new immigrants that says, this is the American healthcare system. This is step 1, step 2, step 3. But you're right. It's like so complex that I think what I would suggest is think more about who you are and what you need, because your needs change with time in the US, and you need change with your circumstances. It might be that when you first come to the United States, you have limited income, you have no transportation, and so you need transportation, or you need to access a provider that is easily accessible to you by public transportation. So I would suggest taking that route, making sure that you're going to a provider that it's easily accessible to you in that way. And then as your situation changes and you're working and you have access to more income, or you have access to an employer-sponsored health insurance or car, then you can now explore. So I would just say start slowly, but think about what you need as an individual. So it would be, okay, right now, what do I need? A primary care provider, and tap into your networks. The good thing is that as immigrants, we're very social. We need to ask people, I need a doctor, or I need healthcare. Who can I go to? And then go there and see if that person meets your needs. If they don't, most of the times you can even ask the provider that you're saying that I would like to transfer somewhere else. Can you suggest, or ask a friend, ask a neighbor, ask Immigrant Community Services. We have these organizations in the community. Ask Pacha Foundation. I need this provider. Can you recommend something? Ask me. That's why some of these programs are being offered. That way people know that these resources are there to really help you navigate the system, because it's really complex, like you said. But we have to go with use as support systems that we have. We have them in our families, in our friends, in our social circles, in our churches. So all of the supports that we have, we can use them.
Thank you so much. Thank you. That's a lot of information. And I hope our listeners are, paying attention to this and are able to share this information out. We have Tanya on as well. Tanya, do you have any questions for Dr. Manka? And then I'll transition over to you.
Thank you. Thank you again for having me also. No, I just want to echo what Manka was saying. It's really important to get plugged in with the health system so that you can better take care of yourself. And Manka, just one maybe question or follow-up. How much weight do you put behind the need to have a primary health care provider for one?
That's a really good question, because I've heard a lot of people say, I'm not sick, so I don't need to go to a doctor. Well, I think a primary care provider is the best way to have kind of access to the system. So once you have established with a primary care provider, you have access to a lot of information. They have access to information and can give you information. So for one thing, you want to know they call it know your number. So you want to know your high blood pressure, you want to know your weight, because you want to live a healthy lifestyle. And part of living a healthy lifestyle is having the information that you need. You want to know your lab values, you want to know all of those things. And so it's really tapping into a primary care provider in the US that you'll be able to access some of those things. I know that in some countries, especially in many African countries, you can just go to a doctor whenever you want to, and pay and get things done. But in the US system, it's establishing a primary services or establishing yourself with a primary care provider that you can go in and get some of those annual routine preventative visits done. They will tell you, once they do that visit, they do the checkup, they'll tell you if you're meeting, if you're overweight or obese, and that the majority of the US citizens are overweight, obese, and we then know what can happen once you're overweight, obese, you're at risk for more conditions. So it's some of those things that once you're plugged into a primary care provider, you know your numbers, you know your health statistics, and then you can start doing the work to maintain, or you can start doing the work to improve. Our goal is to be healthy, so you cannot be healthy without knowing your current health status. And tapping into a healthcare provider gives you that information that you need to either maintain or begin to do the work to improve your health.
Thank you so much. So we've spoken about health inequities, we've spoken about racism, we've spoken about how that affects the healthcare system. And then you mentioned prevention, meaning preventive services are so key to a healthy community. And then you mentioned status. So I'm going to transition because these are key terms. So when we talk about chronic illnesses, long-term, and also a lot of things that could be preventable, we would like to switch gears into the HIV epidemic in Maryland, which continues to face challenges. There's a lot of challenge in HIV prevention, diagnosis, and care engagement. And over 4,000 people with HIV in Maryland are estimated to not know their status. And 1 in 5 new diagnosed people were diagnosed late, which increased 10 times their risk to die within 3 years than individuals who were diagnosed earlier. So again, preventive, knowing your status so that you're able to act upon it really quickly. So Tanya, there are specific populations that continue to bear disproportionate burden of this epidemic. In 2019, the rate of new HIV diagnosis was more than 10 times higher among non-Hispanic Black individuals and 5 times higher among Hispanic individuals when compared to the rate among non-Hispanic white individuals. Now, I know that the Immigrant Community Services has partnered with the Michael and Maurizia Pacha Foundation to try to address these gaps. And I know you're doing incredible work, and we would love to have you talk about the program called Pacha Hive, the Hive Care, right? It is, and we'll put up a little information just after you speak for our community and our watchers to see. But Tanya, we are trying to break the barriers and this narrative of having Black and immigrant communities show such high numbers in some of these long-term illnesses and diseases. And we're trying to break that narrative by raising awareness, by talking about the resources. Dr. Manka has said that there is this huge amount of resources out there, culturally appropriate information that's out there, and the importance of early testing, early diagnosis, knowing your status, and taking advantage of what is there to break these racial boundaries, to break these disparities. So Tanya, please tell us about the Hive program and what you're presently doing with the Pacha Foundation and Immigrant Community Services. Dr. Manka, please stay. We might have some questions for Tanya and you later.
Thank you. Thank you for giving me this opportunity. So the Hive program is actually HIV engagement program, which is a community initiative that is being implemented by Pacha and Immigrant Community Services in Montgomery County and PG, Prince George's County, to bring awareness to HIV, sometimes because this is a condition that is not talked about much. We might think that it has ceased to exist, but it is very much still alive. And as Josephine mentioned, the numbers are alarming, even for people that are in the healthcare field, to be hearing such numbers, especially living in the first world, where there have been advances, in treatment and research, and people are able to live healthy lives, even with HIV, be productive, go to school, have families, and live beyond, you actually go into retirement when you have HIV. So before, it used to be like a death sentence, but it is no longer that. And the public at large might not be aware of that because they don't know the options. Information is power. So as a Hive, we are going out into the community to do outreach, to educate people about HIV, how it is affecting people, individuals, families, and the community at large, and the options that are there. For instance, testing, just encouraging people to get tested so that they know their status. If they are negative, then you know what to do, to stay negative. If you are positive, it's not the end of the world. It's not it's not a death sentence, like I mentioned. You then seek treatment. And as PACHA and Immigrant Community Services, we are there right when you get diagnosed, for that journey with you. We hold your hand, we educate you about what it means to have this diagnosis in this day and age. We connect you with the resources that you need. For instance, you might be somebody who doesn't have insurance. So the first stop would be making sure we help you to apply for insurance. And then through the state, there is a medication assistance program where you don't have to pay anything. So we make sure we connect you with that. And right there, two of the problems are taken care of. We connect you with a provider. This could be a primary care doctor, it could be an infectious diseases specialist that will help you, take care of you, to make sure that that condition is controlled, your numbers are kept in check, and educate you about what it means to have an undetectable viral load, where you want your CD4 count to be, and what kind of lifestyle, because I mean, it is a huge diagnosis. You'd have to change some things in your life. So all that, and with this program, we have navigators that we work with. So these navigators are the ones that really help you with linking you to all the things that you need, be it transportation, housing, financial assistance. The list is endless. Whatever you can think of that you need, we will try to find a way to help you. This is through organizations in the community, as well as county and state organizations that put money out there. This program, this Hive program, is actually sponsored by a federal grant program, the Ryan White grant, and it provides money for all this to be done. So other than testing and outreach, we're also searching out for people that already know their status. You might have come from somewhere already knowing your status, but you come here, you don't know where to start. You just go and live, your life not knowing what the next step is. We are reaching out to say, we are out here, get in touch with us, and we'll help you to get connected. We'll help you to get treatment. And you might be somebody who at one point you had a doctor, and maybe the relationship stopped working, like Dr. Manka said. You just felt it's not working, and then you dropped out of care. We are also appealing to those people to say, if you are living with HIV and you have stopped going to your doctor, you have stopped taking your medication for whatever reason, we are available to support you. We are available to find you the care that works for you, that is culturally sensitive, that meets you at your point of need. Probably you dropped out for reasons like you didn't have transportation. This program provides you with transportation to go to your doctors. Make sure you have good nutrition, because I mean, you cannot be healthy without proper nutrition. So we try to address all the aspects to make sure somebody can live their full, healthy life. I hope that answers your question.
That does. Thank you so much. And I mean, the fact that number one, HIV is no longer a death sentence. People are living long, productive lives. When they're on ARVs, antiretrovirals, they can actually reduce their viral load to a point where it can also be undetectable. And that's such a great and hopeful, because I think the stigma that has been around HIV has really been one of the barriers. And I think it would be great for people to know the importance of knowing their status, because I don't know if you, Tanya, want to speak briefly about, some people say, well, I'm married. There's really no need for me to go do testing. Well, I'm this, so there's no need. And it does not discriminate.
Yes.
HIV does not discriminate. Everyone is at risk, irrelevant of your status. And so the importance, again, as Dr. Manka had said, of knowing your status, knowing where you stand, because the sooner you can address it, the faster you can continue your life, with very limited. And I know that there are lots of new medications that are out that may just be once a day. And, and so there's so many great work being done by Ryan White and so many other, great institutions to make this no longer a death sentence. And so I don't know if you can just briefly, again, Tanya, talk about this, the destigmatization of HIV, the importance of knowing, irrelevant of your status, whether you're married or not. I think will be helpful just to encourage people about why it's so important for this early detection and the services that make it, as it's a challenge. It's still a long-term care that is required, but it is possible.
Yes, absolutely.
And the support group that you're also doing, we're very excited about the support group that you have created, that you're working on.
Yes, absolutely. I'll touch on that too. So yes, you can never know. I mean, the person that you absolutely can trust 100% is yourself. You can never know what the other person is getting up to. So, and I think, I mean, you might have gotten it not by fault of your own. Most of the time, that's the case. And it's just good to know. I have seen when we do our outreach and testing, the relief that people have when they receive those results and they're negative. It's like a Lord, even though they may have come in thinking, oh, I should be fine, there's still an apprehension. You're still thinking, what if? So it's just good to periodically get tested, because again, if you think you are protected and your partner is doing other things on the side, in the end, both of you will suffer, and there is no need. If you find out early, you get treatment. And if you actually engage in lifestyles that predispose you, that make you more likely to get HIV, there are also options where you can be on medication to prevent you from getting HIV. So there is a lot of resources that are available. And I would also like to say it's for the childbearing people in this country, thankfully, when you get pregnant, you do get tested for that. But it would be good to know even before you conceive, as you are planning to start a family, it's just good to know that you're starting this family with a clear conscience. You both get tested and you start your journey. And Josephine was mentioning the support that we are providing for the people that are already living with HIV. Besides connecting them with the resources that they need, we also understand the burden, the mental health burden it has on the individual and the people that surround them. So we started a support group where people can come to talk. There are people that have dealt with HIV for a long time that could have some valuable input to help those that are probably getting newly diagnosed now. And there are people that may have questions. They just don't know what this means for them. So there is a whole mix of people and emotions that we can work through. And this is not like a medical setting or a clinical setting. It's just people talking and trying to support each other. We facilitate. We are there to help to answer any questions, but really we encourage interaction between the participants. And at the same time, we actually are encouraging people to come out of that shell and destigmatize HIV, because when you start talking with other people, then you realize it's not just me. That person looks healthy and, they're going about their life. I can do the same. It's just a way to encourage one another.
Thank you so much, Tanya. Thank you. We're very excited about that. One of the concerns in the community is, as Dr. Manka had related, is the trust, and confidentiality is key and very important in situations like this. Can you talk a little bit about the trainings the navigators have gone through, HIPAA standards, and also the intimacy of these groups and the confidentiality that is done, so that these are done, again, with a lot of sensitivity around the community, whilst we're doing community outreach and encouraging, faith leaders and communities to be very accepting and to understand the meaning of HIV?
Yes. So privacy and confidentiality is really important, especially when talking about a subject that's considered taboo in some cultures. So before we even set our navigators to go out there and interact with people, we train them. We make sure they understand in this country there is a law that stipulates that you cannot share anyone's information, anyone's medical information, their identifying information without their consent with anybody. Be it another provider, they have to give their express consent. They have to sign to say, yes, I'm giving permission. And I feel that is really important for us as the providers to understand, and also for the people that we serve, so that they know that we take their confidentiality seriously. We really safeguard the information that comes into our hands. We encrypt our messages. The documentation that we use is approved by the state, and we don't use personal devices for intake and for keeping records. So all those are measures that we've put in place to make sure that privacy is ensured. And Dr. Manka was one of the trainers for this HIPAA training, which is the Privacy Act training that is used in the medical system in the United States, not just for us, but the whole medical system. And when it comes to the support groups, what we have done is we have kept it closed. In the sense that for one to be admitted into the group, you first register. There is a number or an email that you register through. And then when your registration goes through, you get a number and a passcode that you use to get in, so that not just anybody from out there can just dial in and listen into the conversations. For the in-person groups, and both the in-person and the virtual, we ensure that before people are enrolled, they understand that whatever is going to be discussed in those groups is private. It's not going to leave the room. It's almost like the Alcoholics Anonymous kind of setting, where what is discussed there stays in those rooms, stays in on those platforms, so that everybody feels secure and they don't feel threatened, that now that the next person knows my information, what are they going to do with it? Or just somebody knowing their status, and we know our diaspora here, almost everybody knows everybody that comes from your own country. So we also try to make sure that the systems that we use for registration, they're really secure. Nobody that work with you directly will be coming from your own country, so that we put a security measure there to make sure that information will not get back into the community, because it doesn't hurt to have many layers of the security. So these are all measures that we have put in place to make sure we protect people's privacy.
That is incredible. Can you hear me?
Yes, now we can.
Thank you so much. So for our listeners, I'm going to give the phone numbers that we have, and also at the bar of the video you're watching, you will see Tanya's information, and you will see the contact information of where you can reach the Hive program, but I'll give it to you as well. The phone number is 301-850-2991 and 240-636-3745. And you can also reach us at 443-671-7310. The email is hive, Hive, at pachafoundation.org. And the website is www.hivecare, it's HIVECARE.org. And our handle for Facebook, Twitter, and Instagram is HIVECAREMD, HiveCare MD. So this has been really a great segment. I think I've learned a lot, and I hope our listeners have learned a lot. We are very honored and humbled that we can bring these segments to our communities, and we can talk about health, overall health and wellness, and we can also talk about cancer-related illnesses and HIV, most importantly, to end the HIV stigma, stop the spread, and prolong life. So, Dr. Manka, do you have any questions for Tanya, or any last word to say? And then Tanya, over to you once Dr. Manka is finished.
Thanks so much, Tanya, and everyone. That's a really amazing program, and I'm glad we have it for our community. I guess my last comment is really a plea to the community. To be able to stop stigma related to HIV or any disease, we need to talk about it. We need to normalize it. So my plea to the people, key informants, the imams, the priests, whoever it is in the community, let's talk about it openly. Let's begin to have these conversations and talk about HIV, talk about diabetes, talk about cancer. They are all medical conditions that people in the community are facing. There is no need that we have to have people be afraid to tell their mother, their brother, their sister that they have this condition. We need to start talking about it. And then who's a brother, a sister, or an uncle, a niece, when somebody tells you, accept it and do not try to place any blame on them. We have to take a step together as individuals and as communities to begin to break the stigma. It's not going to come from outside. So my plea is that, let's begin talking about it. If somebody discloses their status to you, accept them and support them. They're disclosing it to you because they need support. So be that support that the person needs. And if you're in a position to be able to influence others, like I keep saying, our spiritual leaders, the imams, the priests, you have a platform that you can use to make sure that we as a community are accepting of each other, whatever it is. If the person has diabetes, let's support them. If the person has cancer, let's support them. If the person has HIV, let's support them. We need to break the stigma down so that we can build health. The stigma, I think, is affecting a lot of mental health outcomes in people who have the conditions that we're stigmatizing them for. So we really need to begin doing the work that is necessary, and it's begin to normalizing it and talking about it and accepting it so that we can grow together and build a culture of health in the community.
Thank you so much, Tanya.
Thank you again. So yes, absolutely what Dr. Manka is saying, it's up to the community. We are our brother's keeper. It is our responsibility if we are going to improve outcomes, if we are going to change the trajectory. We don't want to continue to be, the bad statistics, to be, okay, we're not as worse as them. So to change that, really, the resources are out there. You might not know, but there are programs, there are organizations just like ours that know how to connect you with the resources that you need. It's, I think sometimes in our cultures, we don't want to admit that we don't know, and we just go about pretending that we know. The first step is to admit that we don't know what we need to be doing. Help me. And then when you take that first step, we help you. If we're not able to help you, we will connect you with somebody who can. And Dr. Manka appealed to the community to be accepting. I always say also when I'm talking about this program, it might not be for you, but take the information. It might benefit somebody you know. Please just go and spread the word. And I also would like to appeal to providers. You have a seat in the community as leaders as well. Take time to talk to your clients, not just about what they are coming into the doctor's office for. Their whole, I feel like sometimes the health system here will only care for, if you go in with a cut finger, that's what they will take care of. And then you have to make an appointment if your ankle is hurting. I'm just asking that when it comes to our communities, holistic care might serve us better. Prod, ask more questions. Somebody might come and say, my head is hurting, but that's probably not the problem. Maybe they have something else going on. Maybe they have mental health issues that they need help with. Try to have that relationship with your client so that they can open up and accept help. I have found that as a care coordinator in my regular job, as a care coordinator, I find that patients will trust their providers. They will open up more to their providers about issues that affect them, especially their primary care provider. So if you avail yourself, just allow them the extra 5 minutes to talk about what is really bothering them. It might actually not be them, it might be their child at home, it might be their parent, their husband. Just take that time and educate also at the same time. Healthy lifestyle is important. If it's men, just educating them about the importance of screening also. For women, we do try to encourage each other. For men, it's still a little lacking. So just to encourage them to get their screening for cancer so that when they come into the healthcare system, it's not too late. I find that most people, by the time they're, interacting with the healthcare system, they already have cancer, and maybe it's a later stage that they cannot be helped. So, with programs with foundations like Pacha Foundation, Immigrant Community Services, and I'm sure there is many others in the communities, please take advantage of them and utilize them. Thank you.
Thank you so much. And the same goes with early detection, right, with HIV testing. So what we're hearing is active listening by our healthcare professionals will be key to identifying something that may not be spoken, but you could sense and be able to pull out of your patients if you're actively listening. And also an appeal to the community to embrace each other. to embrace people who come and share their diagnosis, because you don't know how it came about, and it could happen to anyone. This is not a disease that discriminates. And so it's very important, because statistics show that people who are supported by a community or by their community actually have a higher chance to survive and to have longer life. So the health of the community is in your hands. The health of your family members is in your hands. And as I think it was Dr. Manka or Tanya that says, you are your other person's keeper. So you are your sibling's keeper, you're your community member's keeper. And so we should do as such. I thank you both so much for such a great informational session. I want to invite our community members to keep checking Afrique Today online TV for our next series that are coming up. Please also check out www.hivecare.org, www.hivecare.org, and you would be able to read more about our upcoming events and see the work that Pacha Foundation and the Immigrant Community Services are doing to break the disparities, to break the health barriers, and to provide more culturally appropriate services to our communities. We want a healthier, a happier, and holistically better community. I think it will really reflect on everyone. Thank you, Afrique Today Online TV, for giving us this platform to host this program. Thank you to Immigrant Community Services and to the Michael and Maurizia Pacha Foundation. Thank you, Tanya. Thank you, Dr. Manka. And to all our viewers, thank you so much for spending this time with us. I wish you all happy Memorial Weekend, and stay safe, get tested, and take care of each other. Good night, everyone.